jurisdiction. So if you look at just this past week, we've averaged over 1,700 new individuals being tested for COVID-19 per day. That's new individuals, not new tests. There are many more tests than that being done. Out of those, we've had an average of 272 new cases per day during this past week. That's a percentage positivity rate of 15%, which is the highest rate in a week that we've had so far. While the care for COVID-19, I think, has really improved drastically since this pandemic first hit and our hospitals are having better outcomes, we're still averaging just over 2 deaths per day in this county from COVID-19. And that really doesn't account for all the suffering that is occurring, the people who are suffering permanent disability after a bout with this, and just the very long recovery times for somebody who's been in the hospital. As far as hospitals go, per this morning's report from our Jefferson County hospitals, this is just Jefferson County, there were 278 COVID-19 positive patients in our hospitals. 110 were in an ICU bed. 52 were on ventilators, and 41 patients were in hospital under investigation for suspected COVID-19. If you take all of this in perspective, if we look back to late March and early April, you'll recall that all of us were really in panic mode. The pandemic was hitting. Our hospitals were starting to fill up quickly. We were rapidly trying to make plans and address the many different issues in our community, the populations that were at risk. It was crisis mode. Since then, many of us have just grown accustomed to the fact that we're in a pandemic. I think that's normal for us to just have to get to a place where we get along with our daily lives. But some have really decided just to go back to living as if there isn't a problem at all. And I just want to really emphasize that right now we are in a much worse place than we were back in mid-April and late March. COVID-19 is now putting a strain on every part of our healthcare and public health system. Our hospitals are under strain, and you'll hear more about that from Dr. Nafziger. Our hospital staff are getting fatigued. Our testing sites and the staff that work there are at or near capacity and also working very hard. Our labs are reaching capacity. Our public health workers and contact tracers are under great strain, working 7 days a week and currently not keeping up because of the sheer numbers that went way up 2 or 3 weeks ago. Our first responders, many are being taken out by COVID-19, making it harder for them to respond to emergencies. Some of our businesses are being closed not by public health orders, but by the virus itself infecting their employees. So I think many people are used to me quoting numbers, and after a while I think we get a little immune to the numbers. But I really want to appeal to the public. Because our whole system is under strain and these numbers are at an all-time high, we need your help. We need everybody to do their part to turn this around and get this under control. I want to mention in particular young people. Right now, the preponderance of cases that we're seeing, or new cases that we're seeing, are in that age category of 20 to 45. Now, while younger adults are a little less likely to get severely ill or end up in the hospital or die, some are ending up in the hospital. Some are dying. Even for those that are not sick enough to be hospitalized, this is no picnic for some. It can make you very sick, and this is not just the typical flu. Some don't get very sick at all, but you just don't want to take a chance. And I also just want to emphasize that younger people are spreading the disease. So think about who you interact with, think about your family, think about your home situation. those that you might be spreading this disease to that could be more vulnerable, or somebody that's in that chain of spread that could ultimately be a vulnerable person, maybe one of your own family members. We have some public health orders still that put rules on businesses and public venues to help keep us safe and help keep those businesses open. We are now under a statewide face covering order, and we're getting fairly good compliance, but we need 100% compliance with that to really be successful. And I finally want people to think just about not only those businesses, those public places that are under rules right now and where face coverings are required, but really think about those private gatherings, even in your own home. Who's interacting with whom? Where have you been? Where have other people been where they might have been exposed to this and not know it yet? That's where we're seeing a lot of spread. That's where government doesn't have a lot of control over behavior. So we really need you to think about that, protect those around you, and make sure you are being safe in those settings. Thank you.